This video abstract provides an overview of our pilot study entitled Best Worst Scaling to Prioritize Outcomes Meaningful to Caregivers of Youth with Mental Health Multimorbidities.
Of the 2.8 million school-aged children who have a developmental disability, up to 80% will have a coexisting mental health morbidity. Care management for this youth will require interaction not only with multiple providers in different sectors, such as the medical and the school sector, but also management with more than one treatment and more than one treatment modality, which includes medications, behavioral management, and others. So in these settings, caregivers are faced with really complex decision making, where more than one outcome may be desired. However, there is very little evidence to support whether one or a combination of treatments works best to obtain the desired outcomes. And this is why this is an important gap in our understanding of how caregivers or families make these trade-offs in terms of understanding what are the best outcomes or the outcomes that they desire the most, but also how can we start incorporating outcomes other than the clinical, such as life outcomes that are also important to caregivers.
Our research paper investigates priorities using a novel method that combines different attributes of outcomes that can be competing outcomes into a single profile. The instrument was developed in partnership with our caregivers, who are also co-investigators in our study, because we wanted the outcomes and the attributes in our experiment to represent real-world decisions and be of high relevance to the families and caregivers. So what we do is we place multiple attributes of different outcomes into a profile, and we ask the individual to consider each one of those relative to each other. So unlike a Likert response scale where individuals are ranking from 1 to 5, whether they like this outcome or not, we are asking them to consider them jointly. And here we'll provide you with an illustration of what a typical question looks like. There's a number of different things that a caregiver must select from. Our outcomes were organized into outcomes that related to the child's future independence as an adult, outcomes that related to some of the short-term benefits, outcomes that related to the child's symptoms, and then also outcomes that related to kind of more of the social well-being of the child and the family. So we're not asking them to rank them, but we're asking them to pick the one that was most important. When we asked the individuals to identify these outcomes as most and least important, because they were considering all of these outcomes relative to each other, at the end, the information we analyze from this survey can be ranked order. We get a mean score for each outcome. In this figure here, we illustrate how the outcomes are ranked. And so what we illustrate here for you is the attributes, which are the outcomes on the left-hand side. And on the right-hand side are the bar graphs, which represent the mean scores. They're ranked in a way from most important to least important, so positive to negative. And you can see that the size of the bar indicates the relative importance of that attribute.
This work demonstrated that using preference elicitation methods allowed caregivers to discriminate among competing alternatives for outcomes that they desire. This is an important contribution for patient-centered research, as it opens up the toolkit of possible methodologies that can be implemented in other settings, such as for other populations that face chronic conditions and in which there's more than one treatment or more than one outcome that is desired. In addition, traditional metrics to measure effectiveness of treatment have traditionally been focused on clinical outcomes, and more recently, more importance has been placed on quality of life and patient preferences. But what we bring with this preference methodologies is the patient experience, which hasn't been accounted for before. So it's clearly a new contribution to the field. In addition to that, we have a few examples of how preference solicitation methodologies can be used in clinical decision making to facilitate conversations around risk management. However, this field is in its infancy, and we clearly see an opportunity for growth in using these methodologies to inform day-to-day decision making in the clinical setting.